Good morning and thanks for joining us on the Friday edition of TVC Breakfast. I am Veronica Dan-Ikpoyi. I'm not here alone. I have Kemi, Fola-Adeyemo. Kemi.
Thank God it's Friday.
Right.
Good morning.
You're looking forward to the weekend, obviously, with the way you said it.
I most definitely am.
All right, let's just quickly look at some developing issues around the country. And one quick one that would affect Nigerians is the Joint Health Sectors Union strike. That they came out to say that they are embarking on an indefinite strike, and that it would begin at 12 midnight on Thursday. So I believe it has started. And they are saying that this is a matter of agreements with government. That is why they are embarking on this strike, and they want the government to look into it immediately. That they have seen that government has the tendency of shifting grounds with regards to agreements reached. This agreement dates back from 2014, and some agreements was reached in 2017, but they are seeking consolidation on all of these agreements that were reached, and they are asking government to do something as quickly as possible. But the issue for me now is why now? You know, this current administration is winding down, just counting hours to, you know, going out, handing over rather to the incoming administration. Why not just wait for the incoming administration, have a conversation, table your issues before the incoming administration and see how they address it?
Absolutely, and there are indeed long-standing issues, not this year, not last year. They date back to, that long, about 6 years or if not more than. And it's a critical question you've asked. And only days ago, the Association of Resident Doctors and the NMA also started and called off this. It was a warning strike, but this is different. They call the health workers strike an indefinite one. This latest episode is said to be an indefinite one, which could end today. It could end, even longer. No one really knows. And so far, not much has been heard about the impact of the strike, but one can imagine how one day of downing tools in a critical sector as health, how that will impact on the system, on patients, on healthcare delivery, and all that. So we don't know much for now. But yes, it's about welfare. These are familiar, demands that we've always been faced with when we look at, the strikes by these critical health workers. And what also beats me is the fact that some of their grievances also happen to do with allowances, unpaid COVID-19 allowances. So, of course, many emergency critical, sector people were working at the time, and the press, journalists and all, of course, we saw how hard the health workers also worked, and for that to also be among their demands too, that is also, something that that one would naturally raise an eyebrow for. They're also talking about, non-implementation of their demands that retirement ages should be increased to 65, and a host of other demands, that they say they want. We hope that there will be some form of response, just like it happened for the doctors, for the medical doctors, because this is such an all-encompassing association of, health workers, scientists that even go beyond the hospitals, institutions, and the like. So, as at yesterday, they said they had gotten across, journalists said they had gotten across to the health minister, but no response yet.
So I am hoping, because the president has said that the ministers can keep working until May the 29th, when the handover is done, that there will be some form of conversation between the health ministry and perhaps the labor minister as well, and everyone that is involved with regards to this matter, such that there is some sort of resolution reached, and then the incoming administration, they can table that before the incoming administration.